Good morning, everyone, and good morning, Doctor. Today, we're going to share you our proposal with a title See Well and Live Well. So our proposal is for health and vision care for the community. It's a free health consultation, eye screening, and eye health awareness program for B40 communities. Our group is Urban Poor, and this is our group member. So this is our executive summary. Our program is See Well and Live Well. And our target is approximately 50 residents from the low-income B40 families who stay in the Project Perumahan Rakyat PBR in Kuala Lumpur area. The organizer is the bachelor students from the Faculty of Health and Life Science and the Faculty of Health Life Science of the Management and Science University with a collaboration with the community leaders and local health partners. Our proposed date is Tuesday, 18 August 2026, and the time is from 9 a.m. to 3 p.m. And this is our learning outcome. So for community partners, so they can be able to learn identify their individual's health and visual problem earlier so that their vision problems and health problems could be identified earlier before the significant symptoms appear. And then this will also encourage them to have a good health behaviors so they can have a routine eye and health examination, proper health and visual habits. They can minimize their digital eye strains, maintaining a good health lifestyle and also obtain a professional health care where it is needed. And also they can recognize their common eye and health conditions. We can list out these signs and symptoms and also risk factor of the common health conditions such as hypertension, diabetes, or maybe even high cholesterol, and the eye conditions such as refractive error, cataract, glaucoma, diabetes, retinopathy, and dry eye disease also. And we can make primary eye care and healthcare service more accessible. So the participants can obtain appropriate advices on the eye care, spectacle wear, reference, and also healthcare for the further examination when they're needed. And at the same time, encourage the participants to utilize the available healthcare systems within our healthcare systems. And we can increase the awareness of their health and vision care. So we can raise the public awareness of the preventative eye care and encourage early detections of their health and vision problems in the community. And they can receive health consultations. They can receive answers to their health questions. Whereas for the students, we can enhance the clinical knowledge and practicals of our skill. So while doing those practical and basic assessment, we can practice our skill, and then we can develop effective communication and patient consultation skill through the interactions and the community with the community members from the various socioeconomics and cultural background participants. And we can also enhance the teamwork, leaderships, and organization's ability through this planning, coordinating, and implementing of this community-based healthcare program. We also can strengthen our professionalism, ethic, and also social responsibility and dedications by the providing high quality healthcare while demonstrating empathy, respect, and also cultural sensitive toward the underserved populations. So this we gain real world experience in the public health and, and community service. And this is the reason why we should have this program, and this program should be organized. First is awareness. So we can, by giving those low income B40 families to accessible, affordable housing, the Malaysian government established this Project Perumahan Raya PBR. So these families often face financial hardship and difficulties to access healthcare services. So as a result, they are frequently overlooked until they have an impact on their daily activities. So hence this community service potentially raise their public awareness of their eye care and body health and emphasize the importance of early detections, and we can give in time timely reference so that the participant who's showed the screening result with a suspected disease will be recommended to visit nearby clinic or hospital to have a comprehensive examination. And we this also can be a practical learning platform so that get the opportunity for us to apply our clinical knowledge, communication skill, and also through this direct participants in this community activity. Next, we can develop a sense of social responsibility by participating in this kind of a real world community service activity, so we can develop more stronger sense of social responsibility, and this also can fulfill the commitment of the university since they trying to improve the healthcare accessibility for the underserved community. Next, I will pass this sharing to my partner. Thank you.
Next, siapa?
Introduction, and then you may.
Okay. Hi, good morning and assalamualaikum everyone. Thank you, Dafa. My name is Ezaini Darus and I will be presenting the introductions of our community service proposal. So our proposed program is entitled Health and Vision Care for the Community, where there will be free health consultation and eye screening program for B40 communities. Community service play an important role in improving public health awareness and promoting disease preventions. Through this program, we aim to provide free health consultations and eye screening service to the B40 community. So helping them gain better access to basic healthcare. At the same time, this program allows us as healthcare students to apply our knowledge and contribute meaningfully to the community. Next slide. Okay, this is about background and problem statement. Our proposed program will be conducted at PPR Desa Rejan, Setapak, Kuala Lumpur, which is one of the people's housing project developed to provide affordable housing for low-income families. The community consists of children, working adult, older adult, and individual living with chronic disease. Many residents experience financial constraints and may have a limited access to regular healthcare and eye care services. So by organizing these programs at PPR Desa Rejan, we hope to improve health awareness, promote preventive healthcare, and support the early detections of health and vision problem within the community. The main issue affecting many B40 communities is the limited access to preventive healthcare services. So financial limitations, lack of awareness, and competing daily priorities often lead people to delay routine health and eye examinations. As a result, chronic conditions such as diabetes and hypertension may remain undiagnosed. So while vision problem like refractive error, cataract or glaucoma may not be detected until they become more serious. these conditions can affect children's academic performance, adult work productivities, and all the adult independence and quality of life. Um, Therefore, providing free health consultations and eye screening is an important initiative to promote early detections. So increase awareness and encourage participants to seek appropriate follow-up care when necessary. So I pass to my group member. Next slide.
Assalamualaikum and hi. My name is Norain Alia. So I will proceed our presentation with objectives. So the objectives for our event is to provide free basic health and vision screening services for the B40 community, which enable early detection of potential health and visual problems. Next is to promote awareness of eye health, cardiovascular health, nutrition, and also community safety. And then to encourage the adoption of healthy lifestyle practices and preventive healthcare measures among community members to improve overall well-being. And then this program also help in identify individuals who may require further assessment and provide appropriate referrals when necessary. And lastly, to foster interdisciplinary collaboration among students from various healthcare programs such as optometry, cardiovascular technology, nutrition, and also forensic science in delivering community-based health promotion and screening services. And then next slide. Moving on to the tentative program. So as we proposed, the program will be on 18 August, Tuesday, 18 August 2026. So so at 8 a.m., we will depart from MSU to PPR Desa Rajang Setapak, Kuala Lumpur. So we will estimate the arrival time is at 8:45 a.m. So as we arrive at the venue, we can start to do to set up the program and also do participant registration. So on at 9 o'clock, we can start free health and eye screening session until 12 p.m. We will take our lunch break for 1 hour. So on 1 p.m. until 3 p.m., we can continue health and eye screening. So at 3 p.m., we can start packing our equipment and depart from PPR Desirajan to MSC Shalam. So that's all from me. Next.
And thank you. So let me introduce our committee's member. First, this is our program director, Mr. Anjani bin Darus, and then our treasurer, Muhammad Alif bin Zulkifli, and also others committee members like Ayah bin Muhammad Hari, Aishirika Ahmad, and Mr. Hidafa.
Yeah, hi, good morning, everyone. So I will explain about our expenses. So first we have the eye screening equipments. I didn't include the health screening equipment, as we can adjust that together later. So we can borrow all the eye screening equipment from MSU directly without any costs. And then number 2 is reading spectacle, which is sponsored. Number 3 is school necessity, which I put 5 ringgit per unit, which include some basic necessities for the children. And then number 4 is basic necessity donation, which is also sponsored. Number 5 is lunch for our committee, which I put 10 ringgit per person, which total up to 230 ringgit. Number 6 is transportation, 20 ringgit per car. I estimated about 4 cars, which will put around 80 ringgit. And also lastly for registration materials such as pens, paper for 10 ringgit. Okay, so total is 320 ringgit. Next slide. So our income estimation, 100% is from the student collection, where we will collect 15 ringgit per student. Will total up to 345 ringgit. And number two will be sponsors. Sponsors is we need to decide later lah if any sponsors is coming in. Thank you. Next.
Good day, Doctor and my fellow classmates. My name is Aisharika Aiman, and I will be presenting why should the students vote for our proposal along with its limitations and recommendations. Firstly, why should you vote for our idea? Our program, See Well Live Well, focuses on providing free health consultation and eye screening services for the B40 community living in PPR in Desa Rejang. We believe this proposal deserves your vote because it represents the true value of community service, serving those in need, promoting health equality, and creating a positive impact on society. Many individuals in the B40 community face challenges such as financial limitations, lack of awareness, and difficulty accessing regular healthcare services. As a result, some health and vision problems may remain undetected until they become more serious. Through our program, we aim to reduce these barriers by bringing healthcare services closer to the community and encouraging people to take more active role in managing their health. Besides providing for free screening, our program emphasizes early detection, health education, and proper referral pathways for individuals who require further medical attention. We believe that healthcare is not only treating illnesses, but also about prevention, awareness, and empowering communities with the knowledge to make healthier choices. This program also creates a meaningful learning opportunity for our students, MSU students, through direct interaction with the community. Students can develop important skills such as communication, empathy, teamwork, and professionalism. More importantly, students are able to understand the real challenges faced by underserved communities and develop a stronger sense of social responsibility as a future healthcare professionals. Furthermore, this initiative supports MSU commitment towards the community engagement and contributes to the Sustainable Development Goals, particularly SDG 3, good health and well-being, SDG 10, reduce inequalities, and SDG 11, sustainable cities and communities. Moving on to the limitation. Next slide, please. Moving on to the limitations of our program. Although our program provides valuable benefits, there are several challenges that we may face. Firstly, we are only able to accommodate approximately around 50 participants due to limitation of time, manpower, and available screening equipments. Secondly, the screening provided is mainly for early detection purposes only and does not replace a complete medical checkup or diagnosis. Participants who require further assessment will still need to complete their uh, professional healthcare services. Lastly, the effectiveness of this program depends on community awareness and participation and willingness to attend the screening. Finally, our recommendations for future improvement is that to increase our impact, we recommend expanding this program to more PPR and B40 communities so that individuals can benefit from accessible healthcare services. We also hope to collaborate with hospitals, NGOs, and healthcare professionals to gain additional support, manpower, and expertise. In the future, this program can also be expanded by including more health screenings and continuous follow-up sessions. This will help the program from one-time event into sustainable community health initiatives that builds long-term trust and promotes healthier communities. Hence, we believe that See Well, Live Well is more than just health screening program. It is a commitment to serving the community, reducing healthcare inequalities, and creating a positive change in people's lives. By voting our proposal, you are supporting initiatives in values, compassion, accessibility, and the responsibility of future healthcare professionals to give back to societies. Thank you.
Okay, as a conclusion, our proposed health and vision care for the communities, free eye health consultation and eye screening program for B40 communities is designed to improve access to essential healthcare service for the resident of PPR Desa Rejan. So by providing free health consultation and eye screening, we hope to promote early detection of health and vision problems, increase awareness of preventive health care, and encourage participants to seek appropriate follow-up care when necessary. So beyond benefiting the community, these programs also give healthcare students the opportunity to apply their knowledge and clinical skill while developing communications, teamwork, and professional responsibility through meaningful community engagement. So we believe that the support of our university, healthcare professionals, and the local community, these programs can make a positive contribution to improving the health and well-being of the B40 community. Thank you for your attention. We welcome and question or feedback from the audience.